that we appreciate James from Mosaic Home Care Group and then has her panel. So thank you very much for being here, and I'll just leave it up to you.
So, welcome. Thank you so much for joining us today. We're going to talk a little bit about social prescribing and this movement towards community engagement and interaction. So we have, as noted, an incredible cast of panelists today. And I'll start off by introducing myself. My name is Josephine Pham. I am the Knowledge Mobilization and Project Coordinator at the Alliance for Healthcare Communities, working on our social prescribing projects. Now, of course, what is social prescribing? And how is this different from, say, a regular prescription you get from your family doctor? And that's where what the main part of what social prescribing is instead of asking, what is the matter with you? What if we asked, what matters to you? Because ultimately, adding on to medication, we actually want to ask and integrate social and clinical models of care by prescribing art, dance classes, caregiver supports, knitting groups, even bereavement groups, and more. In 2018, to give you a bit of context, we implemented a social prescribing pilot project in 11 communities across Ontario, and this, of course, was called RX Community. The Alliance for Healthier Communities is a network of over 100 community-governed primary health care organizations across Ontario, including community health centers, nurse practitioner-led clinics, and community-led family health teams, Aboriginal access centers, and so on. These organizations are team-based and deliver clinical, health promotion, and community support services. The first step, the client, of course, is centered on an individual with social and medical needs with their own interests, goals, and gifts to share. The prescriber, a healthcare provider with a trusted relationship with the client, is key to leveraging healthcare appointments as an opportunity to identify underlying non-medical issues and making a social prescribing referral. When people experience poor health, often the only trusted relationship a client has is with their provider. But despite good bedside manner, a healthcare professional is typically not the best suited person to identify a social need. This is where a navigator or link worker comes in order to catch that warm handoff between the provider and into a connection towards the client with appropriate resources based on self-identified interests and needs. And then, of course, our social prescriptions, which are a wide variety of non-clinical programs ranging from coffee meetups to food subsidies, nature-based activities, as well as opportunities to co-create their own solutions. Finally, the data tracking pathway follows the client's journey throughout the entire process. This enables the integration of lessons learned and enhancing care delivery and monitoring outcomes in real time. But social prescribing is about improving access for people who may face mental, social, and structural barriers to participate. Programs and services are offered at no cost with the encouragement of a healthcare provider and navigator, peer supports, and follow-up to ensure the client is reaching their own goals. More than half of people living in Canada have reported worsened mental health during the pandemic due to social isolation. Connecting to community-based supports has never been more important, and this issue of accessibility with social needs is one that we need to continue. Refining this, the supports that I'm talking about are usually collaboratively offered across a wide variety of partnerships and these kinds of external organizations that span many, many sectors. These are just a few examples from our pilot project. However, I will leave this, of course, to our other panelists to follow up. Sorry. But let's move into what the results were. So as you can see, despite our study period being quite short, only roughly a year, there is a really dramatic decrease in loneliness, 49% after client referral. We also saw huge improvements in clients' health and well-being over time, with significant decreases in the repeated number of visits to doctors' offices. People feel empowered to self-manage their own health. And even though our pilot project has now finished, the work is continuing in ongoing projects that have adapted to the COVID-19 virtual and hybrid context. Partnering with the Older Adult Centers Association of Ontario, the Links to Wellbeing project, right up top here, offers social prescribing for older adults. We also have our social prescribing for Black Communities project that is partnering with the Black Health Committee and the Balsam Foundation to provide culturally competent programs for Black communities and their families. We are also growing the movement of social prescribing in our Ontario-based and Canadian communities of practice. And this is in partnership with United Way BC and the Canadian Institute for Social Prescribing. Anyone interested in social prescribing is welcome to join. Finally, here are our last few considerations when implementing social prescribing. Our goal is to eventually embed social prescribing into the Canadian healthcare system so that no matter where you are, you and your loved ones can be asked, what matters to you? Thank you very much. I'll pass this over to the one and only Dina Silverberg, who will tell us a little bit more about our social prescribing project, Links to Wellbeing.
Thanks, Joe. And I'm so lucky I get to work with Joe. Oh, and I get a clicker too.
Yeah.
So thank you, Joe, and thank you, Jane, for organizing this amazing panel today. My presentation is short, but again, afterwards I left out some business cards as well, so if you have any questions, please feel free to reach out to me. So I'm going to be sharing some information about the Links to Wellbeing, social prescribing for older adults, helping to reduce social isolation by increasing connectedness to local senior centers. So for those of you who are not familiar with the OACAO is the Older Adult Centers Association of Ontario, and we're actually celebrating our 50th anniversary next year. As a recognized leader in the development of quality services, resources, and support for networks of community-based older adult centers, and the OACAO provides advocacy, education, networking, and resources to support over 220 community-based older adult centers across the province. We're the voice of senior centers, and we come together to help develop comprehensive programs and services and to help seniors stay connected in their community. We have centers from Ottawa to Thunder Bay. You name it, there's a center there. So I chose this picture with the birds because when people hear about senior active living centers, or if you're gonna date yourself like me, we used to call them elderly person centers years ago, people would say, well, I've been to a senior center. If you've been to one senior center, then you've been to one senior center. They are all extremely unique. I worked at Better Living for 22 years. We had one site that was at Don Mills in Lawrence, which had very different programming, and we had one site that was at Don Mills in Eglinton at 5 Deauville Lane, which had all the programming in Mandarin. So every single senior center is unique and have different programming. And essentially, it evolves into the social prescriptions. Each social prescription is unique as well. So some senior active living center spaces, so as I mentioned, they are located across the province, and the centers can be individual buildings or part of a larger site. Sometimes people don't realize the senior center is there because they're on the, like at 5 Deauville Lane, they're at the bottom floor in a community housing building, and some people have a separate site altogether. And the centers can also be mobile programs. For example, we have a partner in the project, which is in Muskoka, and they have mobile sites set up all over Muskoka. So the referral pathway for the project is that senior active living centers and primary healthcare providers connect in their community. The primary healthcare provider identifies that somebody is a little lonely, might be a little isolated, mild depression, and can write a prescription to a senior active living center. Once the prescription is received, the person who's in charge, the designated center contact, connects with the older adult and links them to what we call the volunteer link ambassador, which is a peer-to-peer model. They then meet with the client and help them figure out what their needs are, what they would like to do. And then the last part of our referral pathway is that we are using this for evaluation, and the data is collected because we do want this project to last beyond the 3-year funding period. So everyone gets a referral form once they go to see their primary care provider. I'm just going to glance over this. We just basically need to know not much medical information, why they're being referred, who's referring them. That's it. That's our primary objective. We're trying to make this as easy as possible. We also provide to senior centers social prescription pads so they can identify, we have a pickleball court, we have a swimming pool, we do snowshoeing, whatever they want to identify as a draw, we can put that on their prescription pads. This has actually been very effective, especially with community paramedics, because community paramedics in Sudbury have been carrying them with them and offering them to clients, and we're partnering with EMS in Toronto now as well. So some of our successes that a lot of our centers continue to offer virtual, telephone-based programming and in-person programming. Even after COVID, didn't have that before, but senior centers pivoted very quickly. Non-traditional referral pathways, as I mentioned, paramedics. Development, we have a comprehensive toolkit and resources, so any center that gets involved, everything is already developed for them. I'm down to a minute. Development, we have implementation for training for both the volunteers and the staff, and connecting with new people after a difficult 2.5 years. Some of the challenges, again, volunteers. A lot of centers are still struggling to recruit volunteers. Most centers were closed for 2.5 years and are just reopening. Technologies continues to be a problem. Hesitancy among older adults to join in-person programming, hence why we still offer virtual. And referrals from overloaded health partners, the focus on vaccination, and now we're moving into flu season, so there's always something. So how we're doing so far, we have 35 centers, over 40 locations across the province. And the programs that are accessed the most are social activities of 47.1%, physical activities 35.3%, arts and crafts, education, health and wellness, dining, and other. And most clients were not currently engaged in social activities when they were referred. Okay, good, I'm just under 5 minutes, perfect. Thank you so much, and I will be here for the panel, and I've left out some cards. It's now my pleasure to introduce R.A. Manrikan from Wood Green. Thank you so much.
Much. So I'm Ara. I'm here from Wood Green, and I'm here to talk about a collaboration that we did with 880 Cities about a project that we called Seniors Outdoor Activation Toolkit. It was funded by the New Horizons for Seniors program, and a little bit more about us. We are one of the largest social service agencies in Toronto. We have about 750 staff. We span over 30 locations in Mid and East Toronto, and we served about 37 clients every year, and we serve from anywhere from youth to seniors. And our partner was 880 Cities, and they are also based out of Toronto. Their goal is to make the cities affordable and accessible for anyone from the age of 8 to 80. So about our project, it was really about the height of COVID, and as you know, most of the seniors programs were done indoors. And as we all sort of moved towards virtually, when the guidelines a little bit eased, it was a nice weather, senior services, had a challenge of how do we bring seniors outdoors for the programs, and we decided to build a toolkit to show how we did it. And the goal was again to bring out the seniors outdoors for physical exercise, social activities in a safe manner. And our goal again was to pretty much expand our program offerings and also help other service providers to do so. So what we did, we pretty much, in East Toronto, we found out spaces that we could repurpose during COVID. Most of it were parks, sort of outdoor areas around seniors' buildings, and we did programs that were really designed towards sort of social participation and the physical engagement of seniors. We did pole walking, Spanish classes, Zumba, chair yoga, and drum circle. And the toolkit is composed of 3 tools. The first one is pretty much around the co-creation of the outdoor programs with seniors, the types of questions that we asked our seniors about what kind of programs they would like to see, what kind of spaces they'll be looking for, what are their concerns about COVID and safety and accessibility. And those tools encompass a number of questions that really help out to design the programs. The second tool was about the sort of a checklist that we need to have when we go and find a space, pretty much accessibility when it comes to washrooms, TTC stops, access to shaded areas during summer, and this tool pretty much helps to answer all those questions and find a space that's most suitable. And the third tool was about sort of like evaluation tools that really are designed towards informing the next steps after your project and serve as a case for requesting for more funding. So as a minimum viable product of this service works, and this is how we can sort of do it better, and also serves a tool for repurposing some of the spaces around us, senior outdoor areas, parks. And really we designed it with two sort of groups of people in mind. One was the actual service providers. Most of them had experienced trouble with bringing seniors outdoors. We wanted to sort of help them to do it in a safe way. And the other group that we were really thinking about were the communities themselves, when we could equip them with the resources and they could sort of self-organize around the areas near their buildings, the parks, and sort of find out how they can also provide safe programs. The toolkit is available on both our website and for 880 cities, and I'll be happy to share them with you as well. And that's it. Thank you very much. And I'd like to introduce Emma Rooney, founder of Booming Caregiver. Thank you very much. I'll leave this here.
Okay, before I get started, I would just like to invite you to take a moment to take in this park scene with me. And maybe we can just take a nice deep breath in together and out. And you may not realize, but you just did a tiny green micro break. So congratulations on that. A study out of Australia actually showed that just 40 seconds looking at an image of a green roof versus a flat, empty roof could boost concentration for seniors after just 30 seconds. And couldn't we all as caregivers use a little bit more concentration? So one of the things that gets me really excited about social prescribing is we have an opportunity to take the research and to actually use it in our communities. I actually first started hearing about social prescribing through the UK. It was this really neat concept where doctors were getting patients to join allotment gardens as part of their wellness routine and giving out nature prescriptions. And with those nature prescriptions, sometimes they actually had these calendars like this one from Scotland that had these really easy to do things that people could do at certain times of the year that were very locally specific. And I love on this one where they have for October, appreciate a cloud or help a neighbor with their taties, which I'm assuming is potatoes. So this idea that nature can help with our well-being is really not new to me. For the past 19 years, I've been facilitating programs with people of all ages in community gardens and kitchens, in local parks, and even on a therapeutic farm on Vancouver Island. And the thing that I've really seen firsthand is the benefit it has on individuals as well in building community. And that's why I started my own business, a mobile business, Blooming Caravan, really to serve older adults and their care partners, and to make sure that people like Olive can get outside and connect with nature. In some cases, it's about bringing nature indoors. That can even be through online programming and as part of dementia care. So really helping to connect with nature where people are. That might be in their backyard, it might be on their street, or it might be in their local park. And that's why I really love facilitating green community mapping, because it helps people locate those special spots in nature that are nearby. I'm also a horticultural therapist in long-term care. And one of the things I love to see is the benefits of the program that we're doing, even for the staff. And I'm always amazed how these things extend well beyond the garden into cooking programs and so many other parts. So this is the kind of headline that you might have started seeing last spring. Ontario doctors set to turn over a new leaf with programs that let them prescribe nature to ailing patients. And this was really the start of park prescriptions in Ontario. It's an official program where doctors can prescribe time in nature, and it built on the success of the program in BC. Doctors, nurses, healthcare practitioners prescribe going outside instead of drugs first. As a result of all these headlines that people were seeing, one of the things I noticed in my practice is more people were calling me up and booking forest bathing sessions. And if you haven't heard about forest bathing, it comes from the Japanese Shinrin-yoku, and it's about making contact with and taking in the atmosphere of the forest. And it builds on all this research that's been conducted about the immune benefits of spending time in nature. The practice originated in Japan, actually in the 1980s, as a response to the tech boom, which saw people sitting a lot more and really having high stress in the work environment. They developed these nature centers across Japan, and what was incredible, they were accessible by train for people who were living in the urban centers, and they would go there for a day. And the thing that's really awesome for us is they continue to conduct a lot of research into the benefits of connecting with nature, which we're able to use in North America. It was during the pandemic that I started my own forest bathing. This is me with my parents, just close to where they live in a ravine. It was awesome for social distancing, and I actually did my training to become a certified forest therapy guide. This practice is inspired by the Japanese practice, but obviously it's important that it meets the local context, that it's relevant to the community, and especially to the populations that I work with. And what I love about forest bathing is that you don't need special equipment or naturalist knowledge. You don't have to go on a long trek or go to a beautiful destination, and you don't have to have experience with mindfulness or meditation to participate. We can do it right in our city parks, right downtown. We can do it inside. We can do it online in community. And the three key things for me about forest bathing is that it's about slowing down, paying attention to our senses, and just allowing ourselves to be distracted by nature, even if it's just a few minutes a day. The really neat thing about it, as a horticultural therapist, I see all the benefits, the health benefits, but I always think it's about the relationship as well. So building that connection to the more than human world and building community through these types of practices. And yeah, that's why I'm really excited to get as many people as I can out there, and I really hope that we're going to see more nature prescriptions like forest bathing in the future. Thank you. I'm going to hand over to Melissa now.
Hey, thanks, Emma. I don't know about you, but I feel way more relaxed right now. Hi, everyone. I'm going to tell you a little bit about Baycrest at Home. Baycrest at Home is a virtual wellness platform. It's aimed at keeping older adults and family caregivers supported and living well in the place of their choice for as long as possible. First, just a word about Baycrest. If you're not aware of Baycrest, it's an over 100-year organization. I haven't worked there for that long, with a history of helping older adults enjoy a life of fulfillment, inspiration, and purpose. Now more than ever, we're very aware that that mandate includes, and the mission should include, helping people age in a place of their choice. And for many Canadians, that's predominantly the choice is to live at home. We know that older adults, as they choose to live at home, also eventually come up against physical and cognitive challenges, and that when they do, family caregivers play a really important role in helping to keep them safe and well. So Baycrest at Home was set up to bring the specialized health and social care programs that are on our campus, off of our campus, into the homes and into the communities of people across the province and across the country to help make living at home safer and longer a reality. So we do this by addressing a couple of core areas. Social isolation and loneliness is one of them, and education and training and knowledge for caregivers and caregiver supports is another one. These are the core areas of our services. There are also areas that we know the healthcare system is currently underfunded and prepared to help families with right now. We also want adults and older adults and caregivers to feel there's a place, a community that they can come to feel connected, and who share the desire to stay meaningfully engaged. So as a member of Baycrest at Home, you have access to daily programs that help you to provide structure, to provide meaning and connection in your life. And caregivers have a community of people who are engaged in the caregiving role and who can help with support, teaching, knowledge translation, and helping to access resources. So if you're part of Baycrest at Home, you'll meet someone like Patty. Patty is our physical movement specialist. She's part of a team of programmers that we service. Thanks. She brings live interactive daily programs that are movement-based to you through the virtual platform. Through joining Baycrest at Home, you have access to about 40 hours of programming a week. That's curated to meet your needs or the person that you're caring for's needs. That's tailored and designed in a way that is relevant and meaningful to that particular person and their capacities and strengths. Well, it's a virtual program, and we've just talked about forest bathing, and this is a bit of a different approach. Patty isn't staring at a camera, for example, without any idea of who's on the other end. She joins you 15 minutes before the class starts. She says hello. She gets to know you. She's there to answer questions. She even takes musical requests. Patty last week, for example, met with a client to introduce the idea of a Dynaband to help get more out of the stretching class that they were participating in. This week, a client had surgery, and as soon as they were able to, his wife brought the iPad to the hospital room. He joins into the exercise class to do the warm-up and to say hello to his friends. These are just some of the ways that, some of the examples I'm sharing with you, that we build a virtual community by leveraging the power of digital technology, and also pushing back on the assumption that older adults can't connect meaningfully through digital channels, and that they're not enjoyable or useful. You might meet Bailey, or Steve, or Dan, or Avery. This is our team of virtual artists, musicians, storytellers who've taken up residencies in our program. We lean very heavily into the arts as a social prescription because research shows that the arts are very, very effective in helping people stay well. These are some of our partnership programs. We work very hard to bring high-quality, aesthetically pleasing, professionally based programs to people who can't get to cultural spaces or cultural organizations that are running programs on site. And a bit about our caregiver supports. They are evidence-based programs. They're workshops that help caregivers learn how to care with confidence and stay connected and get the tools they need and feel a little bit more understood and supported along the way. So we have a booth upstairs. Please stop by if you're interested for more information. Please connect through the phone, through email, through the website. We'd really love to talk to you, and thanks very much for your time. I'm going to turn it over to Josephine now, and if there's questions, I think that's the end of our formal presentation. Oh, I'm sorry. No, Emma, I'm so sorry.
That's okay,
Jane.
don't worry.
Oh my gosh. Jane, you were on the panel, so you didn't see it. Please come on up, and now we'll hear from Jane, who actually was the one who put this amazing panel together. I'm so sorry.
Don't worry. Okay. There we go.
I'm very short, so I will have to bring this down. So my name is Jane Teasdale. I'm one of the owners of Mosaic Home Care and Community Resource Center. So we are a private organization with a focus on person-centered care within our model, and also working towards social prescribing and integrating that into our model of care.
Just a little bit about what research says about relationships, loneliness, social events, and community information. According to Age UK, loneliness is one of the top 3 concerns of older adults. Attention to social isolation is important as meeting functional needs. What might appear insignificant to a care provider might be deeply significant to the service user, and their family and personal dignity is affected profoundly by the ways in which members of staff behave towards older people. Public Health Agency of Canada, Age-Friendly Rural and Remote Communities drew on focus groups of older adults and service providers. Social networks, social participation, and feelings of belongings are important to healthy living and prevention of isolation among seniors. Older people who remain active in society and socially connected are happier, physically and mentally healthier. I'm going to talk a little bit about the human side and the person-centered care of Mosaic. So we started this about 8 years ago, our person-centered care. It is internationally recognized in the UK. We've written academic papers. And what we felt was within the private home care industry, it was just focused on the medical lens. And so with Mosaic, we have 2 different parts to our model. One is the home care, the social workers, the nurses, the PSWs, our client services team. On the other side, we're focusing on person-centered care and the meaning of me model. And that meaning of me model is an interactive journey into your past, your present, into the key moments in your life, your family, your friends, your pets, your interests, and hobbies. We believe that the person is more than a sum of a series of events and experiences. Personal values and beliefs all shape who we are. First and foremost, the meaning of me is meant to create conversation between the Mosaic caregivers and our client services division, who visits our members on scheduled and non-scheduled visits. We envisage it being used by some of our members, families, to build, among other things, interesting records and collages of life history. So when we start with our clients, for the heavier clients and the longer hours, we're spending time putting this binder together. And it's also connecting to other community agencies. So that's the social prescribing. And it's also finding out what's happening in the community and for our PSWs to attend with our clients to these wonderful programs that many of these wonderful agencies are providing. And how does Mosaic use community spaces? You know, Ara talked about 880 cities and using community spaces. So here we've done, walk downtown around St. Lawrence Market. Another one, we used Whole Foods. They allow us to use the upstairs. We served coffee, and we brought in community agencies that really focused on the social and emotional. So it wasn't just about talking about retirement or home care or whatever. It's those organizations that were key players within providing the social networks for individuals. And another picture is when we were out in the park and we were pole walking. Using community spaces for events, using community assets. And again, that is what Dina spoke about, and Ara as well. And how can we use community spaces? Using parks. This was set in a mall setting, and so we ran musical events, and I think we had a drumming circle there, and lots of interesting things. So that brought the community together, not just older adults, but it brought younger people, school groups together. And why are these events important? They are first and foremost fun and accessible to all. They help and inform us so that we can better serve our older adult client members. We are always learning. And our mix of events mirror those issues noted in academic and practitioner research as being important in helping older adults remain healthy, independent, and socially connected. This slide is quite important because it's talking about the home and place. Keeping people at home for as long as possible, but also connecting to your walkable neighborhoods as well. And that's also for family caregivers, for people that have moved into areas. Okay, what are the walkable areas in your location? What are the parks that you may go to? coffee shops, community agencies, restaurants, cafes. And then also you're needing to look at the transportation and where the museums and the theaters are. This is an activity actually that we've started doing in retirement homes. We started prior to COVID, and also we work with our clients and our PSWs. So it's not just providing home care, but it's connecting our clients to the community. And how do we do that? We look at the 1 kilometer circumference around where the client lives, and then working with them and finding out, okay, what community agencies are there? Do they know where their hospital is? Is there a library that runs programs? Is there a community agency that runs wonderful programs that we can connect our client to? And that's one of the things within long-term care is that disconnect from the community when an individual goes in, or somebody has Alzheimer's or dementia. You know, it's not about just laying in bed. They're still a human being, and they still want to be connected and doing things. We have run wonderful events, reaching out to the community. One was Walk Willowdale, and that was with Natalie Prezzo, who took us around North York and the markets and some of the Gibson House. And she is a publisher. And then Canterbury Place, one of the retirement homes, worked with us, and they provided the lunch. So it is about collaboration. It is about working together. It's about not-for-profits and private organizations coming together and working together for the best interests of our community. Forest bathing, Emma Rooney. So we're doing some wonderful events with her. We've got some programs coming up in the winter months. You'll find the resources on the table over there, but this was about forest bathing. And it was a wonderful event in Hyde Park, and then we provided lunch through one of the retirement homes. And this Emma Rooney will be starting Growing Wellness Cafe. This will be new. This is something Mosaic is sponsoring. This is an online program as well. And then Drumming Circle, Carrie Siegel. She's sitting right there. We also did at Armour Heights Church. So we had a group of people, and it was a wonderful session, really good. So we were pleased to have Terry as well. Holiday festive tea. So these are the ways that Mosaic connects to the community. We don't charge for our programs. We've kept them going for 12 years, and we continue to do that as well. We do have a wonderful newsletter with all our social programs. And I'd just like to do final thoughts. This is a quote from myself. A world in which we can connect meaningfully, find meaning and identity and support, irrespective of age, support needs, culture, gender, requires a much more connected, informed, and inclusive and integrated community. And thank you very much. So, on that note, I would like to call Josephine Lam from Alliance for Healthier Communities. And I would just like to thank, all the organizations. This is the first time that we've all come together and working online and really honing down what we provide within social prescribing and community. So for a group of organizations to come forward, some private, some not-for-profit, some from hospitals, Alliance for Healthier Communities, I think this is amazing, and we appreciate you coming today. We are going to do the panel, so this is, Josephine does have some questions for the panel. We will have a few minutes for questions as well. We do have resources over on the table, so before you go, we have information on social prescribing and links and all sorts of things, so thank you, and I'll pass you over to Josephine.
Actually, you know what, Jane, you can keep that.
Okay,
Because it goes to show you can be young and still have tech difficulties. I don't trust myself.
That's all right.
So on that note, I actually would love to ask Dina if you'd like to start.
Is this on? It's very formal. Actually, I'm pretty loud. I don't need the microphone. Go ahead.
Thanks, Dina. But how have seniors' active living centers connected isolated seniors with community-based programming during the pandemic? I know very well that there's been quite an interesting hybrid model that, OCAL has implemented.
Yeah, thank you, Jill. That's a great question. So prior to the pandemic, senior active living centers had all their programming in person at the site. And during COVID and the pandemic, the centers pivoted to a hybrid model. So right away they offered virtual programming, and the nice thing is that they're still offering a number of those virtual programming. We also have a number of centers that are part of the Senior Centers Without Walls program, which is phone-based program, because we also have a lot of seniors, especially in Toronto, who don't have access to technology, who couldn't access the virtual support, so they could participate in free virtual programming, and they could participate in free phone programming, as most centers also waived their membership fees during COVID to support older adults.
You ready for the follow-up?
I'm ready for the follow-up.
And I think something that the Alliance holds very close to our heart as a nonprofit is that there are a wide variety of client demographics that we serve, especially from marginalized communities. So how does the Older Adult Centers Association of Ontario really target some of these communities? Like, what are the usual client demographics that you serve? And how can you overcome some of these structural barriers of accessibility?
Maybe I should use the mic. Oh, is that better? So that's a great question. So traditionally, older adult centers, they function on a model of allowing membership for people who are 55 plus. But after being in a center for 22 years, if someone came in who was 40 who really wanted to come to a class, we didn't turn anybody away. The programs essentially, they continue with the hybrid model, but they really were looking at, in terms of demographics, how do they serve people who are isolated, offering programs in different languages, offering different types of programming, so social programming, physical programming, dining programming, emotional programming, mental health programming. They really look at the whole person, and the Senior Active Center is really, it's the care that people need before they are ill, because it gives them a reason to get up in the morning, get dressed, have their breakfast, they're going out to meet with people, they're not sitting at home alone, not eating, sitting on a couch watching TV, they're interacting with other people, they're making new connections, and most senior centers are run by a huge proportion of volunteers. We have a number of centers across the province that are purely volunteer run. We have a center in Sudbury, which is a group of pensioners who come together and they run all the programming in their area. During the pandemic, as I mentioned, a number of senior centers dropped their membership fees, but now as partnership with the Links to Wellbeing program, for those clients who are referred for a social prescription, they can receive free membership programming, free classes. So if there's a fee for forest bathing, as an example, if it's a $5 fee and they can't pay for that fee, those things can be subsidized as well. A number of our communities are quite rural, so we've also offered subsidies for transportation to get people to the centers. And they also offer dining support. So it's really a one-stop shop for a lot of older adults to participate in social programming, and they do their best to remove barriers in terms of financial barriers, social barriers, and physical barriers.
Thank you so much, Dina. And well, to echo what you had said earlier, it's such a pleasure to have this partnership. I hope that if anyone is interested in Links to Wellbeing Project, please approach us afterwards. And moving down the line now, Ara. Actually, Dina has me a little bit worried. Can you hear me as well? No, or you're a little soft. A little soft. Is that better? Yeah. There we go. Thank you so much. So, Ara, what are the needs of your community members, and how does Wood Green and 880 Cities actually promote sustainability in the activities and this co-creation project that you do? These are really the questions that we find are difficult, I think, in the longevity of projects. How do we keep social prescribing going?
Thank you. When it comes to the seniors, because our program really works with older adults and seniors, anyone from 55 plus. So we have clients who are 93, come for a 9 a.m. exercise, they learn how to use iPads at noon. So it's we provide a wide variety of programs, but I would say sort of the most pressing needs are what we discussed today: social isolation, loneliness. It's and of course sort of a broad term that is called aging in place. I thought that's pretty much one of the sort of most pressing needs that we try to address. We have seniors active living centers, which I couldn't speak more sort of well than Dina just did. So that's what we do. We also have medical escorts, friendly visits, meals on wheels, assisted living, transportation, sort of services that are really designed to make sure that our seniors that our clients as well can live as independently and as long as in their homes as possible. And when there is a need for support such as assisted living, we also have that program as well. So I would say it's a very sort of complex issue. We could do several presentations around what it means to age in place. For some of our seniors, it's changing the light bulb. For some of them, is having pretty much making sure that their home is designed in a way to prevent falls. So it's a really complex thing, but yeah, I would say those two. Thank you.
Thank you so much, Ara. And really, what a great answer to asking about how social prescribing can continue on into the future. So I think maybe to kind of jump back to where it begins. So Emma, thank you for your wonderful presentation earlier, that brief part of green social prescribing. And how does someone get referred into a nature-based social prescription? What does your pathway look like?
That's a really good question. So, to be honest, it was awesome to see all the news coverage about nature prescriptions last year. And I started getting a lot more calls from individuals and care partners in the community and social agencies. But I have yet to have the experience where somebody says, my doctor or healthcare provider suggested this. So they're hearing about it in the news, but the onus is still on the individual to find these things in the community after they get excited about hearing some of the benefits. So we still have a long way to go. One of the first steps for me is to tell people, hey, ask your doctor for a nature prescription, because it is actually official that they can give this and they have supports to be able to do this. And so that can get the conversation started. In terms of horticultural therapy, in long-term care, I think it's one of the few places in Canada where it's been quite part of the system. Actually, since the Second World War, there's been, for veterans in facilities, there's been horticultural therapy programs, and that referral system is more like what you would see in the medical system. So the challenge is that the benefits of horticultural therapy can be amazing for people who are aging at home as well. It's not a regulated profession in Ontario, and I think that's one of the barriers. But I think things are going to change. And then I'll just quickly finish up. Another thing I think has really been awesome is in the last 10-15 years, we're seeing so many more social agencies taking on environmental projects, parks and projects, etc. And we're seeing a lot more like nature, environmental focused agencies connecting with social services. And I think that that's really where the future is, to break down those silos and get these groups working together. We even see social service agencies in Toronto that have climate justice as part of their mission, which is really, we've come a long way to actually see that as a key component for healthy communities. So I think it's an exciting time to be doing this type of work, but just the beginning.
Absolutely. Thank you so much.
So, my husband's in a long-term care facility, and if I wanted you to get involved with his facilities and programs there, just the best way is to just call you, right?
The best way is to talk to the facility about getting in a horticultural therapist. And luckily in long-term care, there's many long-term care facilities doing this, and so you can say that. And that, I think, makes it an easier pathway. Yeah.
Thank you.
Thank you so much for your excellent question, because part of what we wanted to just make sure that Emma provided something for everyone, even if you might not be able to immediately jump into social prescribing yourselves, is how can everyone here incorporate a bit of Shirin-yoku into their own lives and nature walks, even maybe without a guide present?
Okay, second question. So we say in forest therapy that the forest is the therapist and the guide opens the door. And I'm sure all of you, maybe when you were a child, you've had an experience where you felt the benefits of connecting to nature, and you didn't have a forest therapy guide to do that. So all types of programs where we help people access their local parks or community gardens are an opportunity for people to feel that. Of course, if you work with somebody that's trained as a guide, it can really support that. But I was telling Melissa that I started during the pandemic doing an online forest therapy group once a week. There's a few women from across Canada who've been participating for 2 years, which is totally crazy. And the very cool thing is that once they learned a little bit from me, now they come together once a week. And the first thing that we do is they share all the things that they've been noticing. For some of them, that's just from their window or from their balcony or from their door. And so they've really been able to make that practice their own. And I think the things I said earlier, slowing down, getting in touch with our senses, so out of our heads, and allowing ourselves to be distracted by nature. I was in the parking lot madly reading my notes, and you know what I'm supposed to be talking about, and all of a sudden I looked up, this is just out here, and at the fence, there was a deer with these huge antlers staring at me. This is just like a couple hours ago, and I was like, wow, yeah, that's what it's about, but so often we just don't take that moment to step away from the computer. So that's one of the biggest ways, even if it's just turning your gaze to the window for 40 seconds.
Thank you so much, Emma. And on that note, we can let you take a bit of a breather and move on to Melissa. So I know that Baycrest offers many arts and cultural programs that are dementia-friendly. So maybe just to talk a little bit more about why is art so beneficial during aging, that for both your mental and physical health, arts can just completely radically improve your well-being.
Yeah, that's a great question. I think that, is this on? Yeah. Okay. I think there's a lot of overlap to many of the conversations that have been and topics that have been raised across the panel is around our understanding of health and our definition of what it means to be healthy, which I think as we've kind of moved forward from the pandemic and recognized that the dimensions of health are so much broader than maybe we originally used to think about. And particularly when we think about aging and growing older, what does it mean to help people stay healthy? So that's where things like the arts come in, and things like opening up your mind to things that are probably experiences that people have had throughout their life, but maybe not thought about them as health interventions. And as we're kind of moving towards supporting older adults in different ways and different models, recognizing that these things are very valid, very critical, very important to mental health, to social health, tapping into imagination, the idea of creativity, which is something that even in later stages of dementia remains preserved in the brain, actually, and is something that we don't harness enough in older adults. So we really need to redefine what it means to be healthy, and incorporating those kinds of experiences, helping people access thinking of themselves as creative people, as people who can learn new things. Finding ways to do that across a number of different domains is really critical. At Baycrest, we've been able to look into those kinds of approaches, but many organizations and many places are having those kinds of conversations, and our job is to bring those together to really move people in terms of asking those questions to their healthcare providers, finding out ways that they can do that themselves, and empowering themselves in that way.
Thank you so much, Melissa. And I think Jane will be coming back up to
Another group coming. So I just want to thank you again. If you have any questions, the other group will need to come in. We went over a little bit. If you have any questions for us, we do have a resource list on the table with our emails on, or you have it at your table, so you can definitely email us. We'll hang around a little bit outside if you do have other questions. And could I just get the group together for a quick group shot before everybody goes? And I just want to thank again, all the panelists and the speakers coming together, definitely on a Saturday. when they've worked so many hours during the week helping families and older persons. And thank you for coming to our presentation today, and hopefully you understand a little bit more about social prescribing. So thank you. Cheers.